Nyctophobia is an extreme fear of night or darkness that can cause intense symptoms of anxiety and depression. A fear becomes a phobia when it's excessive, irrational, or impacts your day-to-day life. Being afraid of the dark often starts in childhood and is viewed as a normal part of development. Studies focused on this phobia have shown that humans often fear the dark from its lack of any visual stimuli. In other words, people may fear night and darkness because they cannot see what's around them. While some fear is normal when it starts to impact daily life and sleep patterns, it may be time to visit your doctor. The symptoms you may experience with nyctophobia are much like those you would experience with other phobias. People with this phobia experience extreme fear that causes distress when they are in the dark. Symptoms may interfere with daily activities and school or work performance. They may even lead to health issues. Having some fear of the dark doesn't necessarily mean you have phobia. However, when the fear starts interfering with your everyday life, it may be considered irrational fear. Fear of darkness and night often starts in childhood between the ages of 3 and 6. At this point, it may be a normal part of development. It's also common at this age to fear ghosts, monsters, sleep alone, strange noises. For many children, sleeping with a nightlight helps until they outgrow the fear. When the fear makes it impossible to sleep, causes severe anxiety, or continues into adulthood, it may be considered nyctophobia. Some adults and children are simply more susceptible to fears, possibly due to their genetics. Nyctophobia may be associated with a sleep disorder like insomnia. A small study on college students with insomnia uncovered that nearly half of the students had a fear of the dark. The researchers measured the students' responses to noises in both light and darkness. Those who had the most trouble sleeping were more easily startled by noise in the dark. Not only that, but the good sleepers actually became used to the noises with time. The students with insomnia grew more and more anxious and anticipatory. Some phobias don't necessarily require treatment, especially if your fear is of something you don't normally encounter in everyday life, like snakes or spiders. Nyctophobia, on the other hand, can make it very difficult to get enough sleep. That can affect your overall health and lead to sleep disorders like insomnia. In general, you may consider seeking treatment if your fear makes you feel extreme anxiety or panic. Treatment options include exposure therapy, cognitive therapy, relaxation. Exposure therapy exposes people to their fears repeatedly until the thing they fear, such as being in the dark, no longer triggers feelings of anxiety or panic. There are a couple of ways to be exposed to fears, including visualizing the fear and experiencing the fear in real life. Many treatment plans blend these two approaches. Some exposure-based treatment plans have worked for people in as little as one long session. Cognitive therapy helps people identify their feelings of anxiety and replace them with more positive or realistic thoughts. With nyctophobia, a person may be presented with information to show that being in the dark doesn't necessarily lead to negative consequences. This type of treatment is usually not used alone to treat phobias. Relaxation treatment includes things like deep breathing and exercise. It can help people manage their stress and physical symptoms related to their phobias. Medication isn't always an appropriate treatment for people with specific phobias. Treatment through cognitive or behavioral therapy can help you overcome your fear and get a better night's rest. If you enjoyed this video, subscribe, like, share, and comment.